Hello, and welcome back to another episode of Straight Up with Steph. Today, the topic is dental microscopes and how you can use that in hygiene. I remember in school, they told us about dental microscopes, and I know it's always been a thing, but I, over 16 years, have not had the opportunity to see how it works or use this myself in practice. I guess I was intimidated by microscopes, thinking that they're like way too expensive. Our practice would never be able to afford it. And also, I didn't want to add one more thing into the hygiene appointment because we already have a million things that we're trying to get done. My guest today, Kristen, is a expert in microscopes. She actually has her own company where she helps train people on how to use it. And I learned a lot from her today as far as how little time it actually takes during the appointment and the huge impact that it can have on hygiene production, your hygiene department, and also patient education and case acceptance. I just imagine if I'm a patient and someone takes a sample of my plaque, throws it on a slide, and I see all of these crazy bacteria on there swimming around and getting crazy, it would freak me out. And I would want to know how to get that healthier. And that's exactly what microscopes do. It's a huge motivator for patients getting healthy, which is what we all want. And Kristen today tells us everything as far as how the workflow goes, what the setup is like, and also how offices can start incorporating this into their practice and the huge impact it can have on a practice's bottom line. This was a super fun conversation today on something that's relatively new to us. So I hope you enjoy today's episode with Kristen. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Miss Kristen. Thank you so much for joining today.
Hi, Stephanie. Thanks for having me.
I know it's really early for you, so tell everybody where you are right now and what time it is.
It is 6 o'clock in the morning in Bangkok, Thailand.
Oh my gosh. I would not be ready to do a podcast at 6 a.m. I get up early, but I'm just not really ready to be on and presentable yet. So I appreciate it.
Well, thank you. I still feel, like I have my morning voice. So I'm trying to have a little tea and get everything awake too.
Yeah, no, you sound great. You look great. Whatever you're doing, it's working. So when I first set up this podcast, I kind of did some snooping around on you online, and I saw that you are a biological hygienist. So, for those who don't know, what does that mean?
So I did my certification through the IAOMT, the International Academy of Oral Medicine and Toxicology. Biological dentistry it's not its own specialty or anything like that. It's more of a philosophy of, treating the patient as a whole and knowing what you put in the mouth can affect the rest of the body, and what you put in the body, or what's happening in the body, I should say, can affect the rest of the mouth. So it's still doing, modern dentistry, but it's aiming to do that in the least toxic, safest way to the patient, and really treating the patient as an individual. Not everybody is the same, digging in a little bit more on that. So everything that would include, on the hygiene side of the house. Another thing that's fun with biological dentistry is we'll sometimes use alternative treatments like ozone, like the microscope, and it's not specifically for biological dentists. That just seems to be, more of who's using things like that.
Okay,
Yeah.
so it's just more of like a holistic view on the patient, which is honestly probably most of us want to practice that way because we understand everything's connected. Is that how you started using the microscope?
It is. Yes. I was in a biological office, and my boss at the time, she said, "Hey, have you heard of this?" And I was like, "Nope, tell me more." She was explaining what you would do. And I was like, "That sounds amazing. Let's get one." And she was like, "Okay, let's." And we did. And then we got trained on it, and it was great.
How long into your hygiene career did you start working with a microscope?
Oh, it had been a long time. It was definitely closer to the end. I mean, I wish I had discovered this years and years ago. I mean, what am I think I'm going on 30 years. So the last, what, 5, 6, 7 years? And then
Okay.
as soon as I discovered it, it was one of those things where you go, where has this been? Why has nobody told me about this? Why am I just now figuring this out? Or why am I just now being introduced to this? I should have known about this 25 years ago. And that was also kind of the impetus because it was so great. And I saw the effects it had on patients and the hygienist too. Like I was, you love it. It's a really fun thing to do. So how it changed so much the patient experience and the hygiene experience, that's when I was like, you know what? I have got to start shouting this to the world. Like, because every hygienist that I knew that I told about it was really interested. And then
Mm.
every single hygienist that I know that uses one to this day says they can't unknow things. Like they can't not use one now.
That's
So,
interesting, 'cause
right.
I remember learning about it in school, and I've been practicing for 16 years, and I've never had the opportunity to use one or see how it's used. So how does that work in an appointment? Like, do you need more time? Is it a completely different flow? Because I know time is always of the essence in hygiene visits.
No, you really don't need more time. I always tell everybody, well, for workflow purposes, do it first because you're looking at a biofilm. So you want an undisturbed sample. So if you're doing like a pre procedural rinse or probing, anything that's going to disrupt that biofilm, just grab your sample first. So, you can go over health history, get x rays, do all that. But then as soon as you seat that patient, grab that biofilm, put it on the slide. You can either review it then or you can seal it and let it settle while you're doing some other things. That's kind of up to you and what you want to do. But I tell people maybe plan on 5, 6 minutes extra time. That's
Okay.
explaining it and everything. You can, to get it. I mean, it's just so quick. We all know how to grab a plaque sample and put it on a, a
Like, do you
slide.
just grab it with a scaler and put it on the slide?
My favorite is that 204, that 204. I like that one. And that EXD 1112 Explorer that can kind of get down a little bit deeper. I like that one. But you can use a probe, anything. I always tell people too, you can get a sample from anywhere in the mouth because we do have like different microbiomes in different sections of the mouth. I always like to go down below the gum line because that's where you get like the deepest, darkest dredges, like get in a really deep pocket. And that's where you're going to see the most activity. That's where there's going to be a lot going on.
So if you have, let's say, a perio maintenance that's coming in and you know that they've got maybe some deep pockets, do you try to get as deep as possible? If you know where a 6 millimeter pocket is, are you going to go right for that or does it really matter?
I'm going to go right for that.
Okay.
but,
Because I
but
would imagine it's different the
it
deeper
is.
you go.
That's exactly right. So that's the other deal is you can get different sites too. Like if you know there's a deep pocket, go for the deep pocket because chances are if you're going to find something, it's probably going to be there. But if you, let's say you've got a patient and they are always pretty healthy, it's a new patient to you, let's say, right? And you're just now
Mhm.
starting all the things. I tell people if you don't know, go find spots that people frequently miss, right? Like the back of a second molar or something like that, hit those spots. But then as you're going around, if you find a deep pocket, you're like, oh, wow, I didn't know this was there. And you're already in it. I'm going to still get a sample just to see what's in there, even though I've already kind of disturbed it with probing. I'm like, I'll go back and let's just see.
Okay. Because, yeah, if you're going through probing and you all of a sudden drop into like a 6 millimeter pocket, you're already there. So you might as well just like swipe it on the thing and see what's in there, right? So, what does when you're looking at the sample, what are you looking for?
You're looking for calmness, right? So I always tell patients, first of all, I tell them, here's what we're going to do today, right? I'm going to grab a little plaque sample and we're going to see what's swimming around in your mouth, right? I always tell them backstroking through their biofilm. I said, and we're just
Oh,
going to
that's
see what's
cute.
in there. It can be a healthy protective biofilm or it can be an at risk biofilm. So that's also one of the things I want patients to know is, things in your mouth are not inherently bad. I always tell them, let's set up a situation where beneficial bacteria thrive and pathogenic bacteria do not. And then we don't have dental disease, be it gum disease, cavities, whatever the case may be. And then when the mouth is healthy, it is not a chronic source of infection elsewhere in the body. So that's also bringing in that oral systemic link. That's like my setup to, so we're going to just look and see what's in your mouth, what's going on in there today. And I tell them before we even turn the microscope on, I'm like, whatever we see, do not panic. If it is terrible, terrible, we can change it. So that's the good news, right? Whatever's there, we can totally transform it back to good and healthy. Know that you have power, use your powers for good instead of bad kind of deal. So I always want them to know no matter what, it's okay. We'll get it fixed. We're not coming from a place of judgment or anything like that. Just like we want to know what's there. So then when we turn it on, what do we want? What does a healthy protective biofilm look like? There's not a lot of population, there's not a lot of movement, and then you're just not going to see certain things, certain pathogens present. in there. So you want it to just be kind of calm and serene. If you see a lot of movement and a lot of population going on, that's starting to be okay. We don't really want that much because things can start to turn pathogenic. And then if you
Mm.
see certain pathogenic bacteria, also, you already know, oh, hey, this slide is automatically high risk because I see X, Y, and Z. What can you see in a slide? So you can see bacteria, you can see fungus, you can see parasites, you can see red blood cells, white blood cells. So if you were to look at a slide and see a lot of white blood cells, that is a little bit of a peek right into the patient's immune system. So they're having some type of immune response. So that in and of itself is a high risk biofilm.
Mhm.
Go, hey, what's going on? Red blood cells just mean, yeah, there's a lot of inflammation. That's another reason, too, when you do get a sample, try to get your sample gently. You don't want to, if there's a lot of inflammation present, if you do get things bleeding, and we all know it can bleed sometimes just by looking at it, it will just start to
Yeah.
bleed. It's just going to make it harder to see the sample. And then as far as
Okay.
bacteria goes, it's really by morphology. So you're looking at them by shape. If you see a biofilm and you say, hey, this is high risk, and you go, you know what? I want to know exactly what's going on in there. I want to know the exact species. That's when you go, hey, we do need to go ahead and send off for your patients that might be reluctant to do any of the other salivary testing. I think the microscope is a great nudge. Like, hey, we do know it's high risk for sure. So let's find out exactly what's in there. That's nice. Also, it's great too because, well, bacteria or fungus. So you can see a yeast overgrowth oftentimes before they have clinical symptoms. And
Oh,
you can
interesting.
Right, isn't that crazy? So that's what's
Yeah.
really cool about the microscope. You have the ability to see these at-risk situations before clinical signs of disease are present. And so then the patient can, we're going to talk about, right, how we're going to get that biofilm back to healthy. And then hopefully they do the things and everything goes the way we want it to. And we never have these clinical signs of disease. We keep things nice and healthy.
So this is huge for patient education, obviously, and I would imagine this is probably pretty good for case acceptance too, right?
It is bonkers. So, like, both of those things combined, it just is so beautiful for practice growth for a lot because it's such an educator and a motivator. So, think of that microscope just like your intraoral camera, except the microscope is for biofilm. I feel like most people are using an intraoral camera now and they know how
Mhm.
much restorative that camera puts on there, just poof, like a picture's worth 1,000 words, right?
Yeah.
So what's a video worth? I mean, it's the same thing, right? But it
Yeah.
really is. It's like, well, there it is. There's no refuting it. So here's what we can do about it if you want to. And most of the time, people see it and the first question is always, is that in my mouth? And then, of course, you're like, yeah, we're both looking at it. And then the second question, if it's high risk, it's like, well, how do I get rid of it? And then we go into, well, we're not getting rid of it, we're changing it. But, and then, yeah, they want to do it. So it's educating patients on what's going on in their mouth, motivating them to move forward and get treatment, whatever that treatment may be. It's also educating them, though, on the importance of the oral systemic link, right? Because we're also talking about all these other things. And when you get it healthy, it's not infecting X, Y, and Z. So it motivates them to just change sometimes their habits on what they're eating. Because when you start to talk about getting a healthy oral microbiome, we've got to talk about nutrition, right? So it's not just, are you
Yeah.
brushing and flossing? It's, how often are you? What are you eating? What are you drinking? How often are you eating and drinking? And it goes into breathing. You talk about pH. So it bleeds into more than just oral education. It's overall health education. And it's so fun. Like patients lean in. I feel like you can just see their eyes light up. Not 100%. We know not everybody, but they do. They do say yes to treatment. So I tell people if you want to grow your practice, you can totally use the microscope to do it. And the earlier the better, if you will, because there's kind of three main ways. One is patient acceptance. So your current patients that you already have, you don't even have to look for new ones. They're there. Get them to say yes to treatment. And then they really love it. Like they're all in. So they're happy. Happy patients talk to everybody else, right? Especially
Mhm.
they've got a high risk of biofilm. And then you're talking about, guess what? These things are transmissible. So you can give your high risk biofilm to someone, they can give theirs to you. So those are really fun conversations too. So then they're like, hey, oftentimes they're like, look, I got to get my significant other in. Like, I want to get their stuff checked too. So that's the second way is referrals. And then the third way, and this one's pretty deep. You can really blow up your schedule in a good way with this, is working with other healthcare providers. So let's say you find a high risk biofilm. Let's just pick, say they've got a yeast overgrowth. If you have a yeast overgrowth in the mouth, there's a very high probability that you have a yeast overgrowth in the gut or elsewhere in the body. Well, that's a great time to go, hey, who's your other healthcare provider that you see? If they don't see anybody, you can refer them. Hopefully you can have someone or we can help them out. If they do have someone though, you can have just a template letter. Hey, Dr. So-and-so, I saw our mutual patient so-and-so today for this. We're working on getting the oral microbiome back to healthy. I know these things can exist elsewhere in the body. I'm referring them back to you for further treatment if you deem necessary, like however you want to word it. Oftentimes this is still kind of new-ish, right? Like I know we're trying really hard. A lot of us are getting medical and dental to all work together, but
Yeah, it's an
still
uphill battle.
it is. So this
Yeah.
other caregiver is going, what is this? Wait, like who is this? Okay. So they're thankful for the referral, right? Like you've given them a patient. Even if it was already their patient, you're still sending them back to them. And then B, they're also going, hey, this person's doing some cool stuff, giving some good care. When they have somebody that needs oral health care needs met, hopefully you're the person they've got your contact info. They already know what you're doing. They can easily refer that patient to you. Also, right now, I mean, other functional medicine doctors, I know some that are already doing salivary testing in their office. Like that's part of their
Mm,
onboarding process. If something pops up hot for them and this patient needs dental care, they need somebody, that's out of their zone of genius. They need somebody to partner with. And I tell
yeah.
people, let it be you. Let it be you.
Well, because you have the same philosophy. I wanted to ask about if this could increase the bottom line in the hygiene department as far as production. You kind of already answered that. So this isn't a commonly used thing. Hopefully it will become more so, but is a barrier for offices using it or not using it because of the expense of the microscope? And does the production that you see completely offset that like relatively quickly?
Barrier to entry. I think honestly, a lot of people just don't know about it too.
Okay, just education.
Right? Like me, like I didn't know it existed. I mean,
Yeah.
I knew a micro, we all had to take micro, right? I didn't know how you would use it in the hygiene room day to day, every hygiene
Okay.
appointment. So I think that is one thing. But then once they do know it's there, I think offices in their mind think it's really expensive. How
Yeah,
am I going
that's
to
what
get?
I would think.
Well, and they can be, but I had one hygienist tell me, she was like, the microscope pays for itself before lunch. So
Mm,
I was like, ooh, yeah, you're right. Like it totally pays for itself. And again, it's just like that intraoral camera. How quickly did it pay for itself? How easy is it to use? And it doesn't, the reality is if you take care of it, which they're low maintenance, and when I say take care of it, I mean don't knock it off the counter, kind of take
don't
care of
drop
it,
it.
right? Like nothing egregious and it will last you for years and years. You're going to
Mm,
want new countertops. You're going to want all these other things. It's almost like a dental chair. It's just there working, doing its thing for
yeah,
forever.
just a workhorse. Yeah. We see scanners, or like Ceric machines, God knows how much those are, and I think those pay for themselves also pretty quickly, so this makes sense.
Yeah. And you're not talking about, like, again, it's like the intraoral camera. There's different price ranges. You can get a microscope, I think, a nice one for like 6K right now ish,
Okay.
give or take, right? Get trained on it. So it's not, I mean, when you start to compare that to, like you said, some other pieces of equipment, then it does make it seem very economical.
Seriously. But too, with everything that's going on right now with like just I feel like dentistry is in an uproar right now when it comes to hygienists specifically. And if we can increase production, and I'm not saying like do unnecessary treatment for patients, but we all know most of our patients have some form of like gum disease, whether it's gingivitis or perio. And if we start treating them the way they need to be treated, that is going to increase production. And using a tool like this that just makes it a no brainer. I mean, if I was a patient and I saw a slide that had a bunch of little bugs like on there going crazy, I would
Yeah.
flip out. I'd want to get that under control. So it really makes sense to me.
That is exactly how it works. So thank you for saying it because that's exactly what patients do. They're like, "Oh my word." And you said
Yeah.
it, like, what's the almost 50% of the people have some type of periodontal disease, right, running around. So in
Yeah.
theory, I always wonder, like, shouldn't that be 50% of our office? Like, we know it's there. We
At
just
least.
need to get the patient to wanna do something about it. That's what's fun with the microscope. And another thing I love about it, I get really excited, is to me, my favorite patients to work with are patients that want to get better, patients
Mhm.
that really are like, "What? Okay, what can I do?" And then it's really fun after you've been using it a while, the patients come in and they will tell you straight up, "My biofilm is gonna be a dumpster fire today. It's trash." And I'll go, "Really? Tell me why." "Oh, well, I went on this trip and I forgot my electric toothbrush, or it's been the holidays, or I've been ill, or life happens," right? Typically, it's the holidays or a vacation, but they already know. So it's fun, and we're like, "Yeah, you were right. That's so a lot going on, mister." So it's really fun. They know, and then they also know how to get it back together, or they'll go, "Okay, I switched this time, this product. I'm using something different. What are we gonna see today?" And it's fun. I don't know, man. It's a box of chocolates. Let's see what's in there.
It's just so engaging with the patient, and that was actually one of my questions. It's like, can you recognize trends? Like, if someone comes in and they were away for a week and they didn't have their electric toothbrush, or maybe they were partying the night before, like, can you almost guess what their biofilm is gonna look like?
There are trends, yes. Like when we first got the microscope years and years ago, the very first thing I noticed just by looking at, right, you're just looking at slides day in and day out and talking to people, all that's fun too because hygiene's kind of, I think it's a little bit of a detective role. Those hygienists that want to get to the root cause and like, what could it be? I'm looking at slides all day long. And one day I was just like, you know what? It seems like everybody that's using sonic toothbrushes kind of have better biofilms. And so then I really did start taking note, like, okay, am I really seeing this? And yes. And then don't you know, when you
Mm.
go back and read science, it does say those sonic brushes tend to remove more biofilm than just our hand. Like in theory, can you do it with your hand? But it's certainly the work smarter, not harder model. So
Well,
that
it's
was
so
one,
technique sensitive, like, we can't expect patients to be able to do that.
right? Like that's why there's technology, feel free to use it.
Would this help with patients? Because in my career, I've had patients that seem to be doing all of the right, quote unquote, right things, right? And they still come in with like persistent inflammation or they still get caries almost every time they come in. Does the microscope help explain why this would be? And then has it changed like the way that you treat patients?
So it certainly can. There's one person in particular that we would see her every 3 months, and she, I mean, for all intents and purposes, she was locked in. Man, this woman had it going on. I had no reason to not believe everything that she said she was doing. I mean, I felt like she was really invested in her health. She would come in and there was very little biofilm, not a lot of pocketing. It was just a lot of bleeding. So there's still,
Mm.
we're like, where is this coming from? And we were like, let's work with your doctor. Da, da. So fast forward to we get the microscope and it's a high risk biofilm. And it was really interesting. So there were certain things in there. In her case, it was spirochetes, which is another high risk pathogen. This is one of many examples. I was like, hey, I don't see your husband. Like, he's going somewhere, right? I just assumed that he was going maybe somewhere else. But I was like, his stuff is getting taken care of, right? She was like, oh, no, friend. No, 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 no. Because he is petrified of the dentist. He hasn't been in over a decade. And I was like, look, I don't mean to call anybody out, but it's him. I'm blaming him. You tell him I said that. I said, I
No
was joking.
way.
He could very well be patient zero. We kind of did think that he was patient zero. And fast forward to, I never did get to see him. Like, I mean, it was just a work in progress, right? Like she was like, I've got to get him in. And I was like, well,
Yeah.
we welcome him with open arms anytime he is ready. But yeah,
I don't think I've thought of that. 'Cause I've had patients like that too. I'm just like, "What the hell?" Like, this person is spotless. They're doing everything they can, and yet I touch their gum and it bleeds, and I don't think that I've put 2 and 2 together that it could be their partner. And it makes me think of even kids, I mean, maybe they're getting it from their parents or they're giving it to their parents or whatever. Oh my god, that's crazy.
totally. Okay, so on that, since you said that also, we have another family comes in, mom and dad both have high risk biofilms, and the kids are young, elementary school. But I was like, you know what? Again, with the microscope, you can do whatever you want to do. When they're in, I was like, hey, let's just test their biofilm and see what's going on. Curiosity again with your detective. I'm like, I want to know what their biofilm looks like. And
Yeah.
don't you know, it was the exact same. Like these elementary age kids had the exact same full on periodontal biofilm that their parents did. They just weren't expressing any kind of clinical signs yet because of their robust immune system. Like, all
Yeah.
the things.
They're
What could it
young.
be? We don't know, but I was like, you're going to if you don't. Like you can clearly see what's going to happen if we don't turn this around. It was very interesting. And of course, the parents love it. So again, you're building so much value into that hygiene appointment that it's phenomenal, patient. So again, when you're talking about, hey, hygienist, how are you going to use this to grow your hygiene department? When you start putting more patients on the schedule, then your schedule gets full, you get fully booked out. Then the other goal is you want this really, really big fantastic short call list so that Tuesday at 10, when you have a cancellation and you can never fill it, you have the longest list of people that are like, look, I'm dying to get in. Like it's still time. So you've got people that are saying yes to treatment, but then you also have people that have high risk biofilms that they may not need active periodontal therapy, but you're like, I still want to see you sooner. What have you done? Let's tweak it. We're going to check that biofilm again. You're going to see them sooner. So that's even, more people on your schedule. And then again, going back to working with certain doctors, like if we're going to talk about getting back into that functional med doc circle or like functional
Mhm.
medicine trained nutritionists, chiropractors, naturopathic doctors, there's a lot of people you can work with. A lot of those practitioners, as far as functional med, things like that, naturopathic doctors, are not signed up with insurance. If you really like stop to think about this part to me was really fun. Their patients are not used to working in that insurance realm, if you will. They are already invested in their health. They want to get better. When that doctor refers them to you, they're like, I'm here to get better, and I'm not going to let insurance dictate what that means for me. Like they're already on board with my health is my health, and no one's going to tell me what I can or cannot do. So that's really fun. Like, that's fun.
That's just a motivated patient population that, like, we all wanna work with, you know?
I tell offices too, if you're thinking about either starting to drop insurance, everybody I know tends to drop insurances. It's a staggered, it's a long time before they don't
Yeah,
like, hey, Friday, we're going to go fee for service kind of deal. But if that's your
yeah.
ultimate goal, the microscope is a great way to build that hygiene department and build a lot of value in it so that people are like, well, I mean, it's different right now. Not a lot of people are doing it.
I know it's not, like, new per se, but it does seem cutting edge compared to how a lot of traditional dental practices are. I don't know about you, but I feel like dentistry is just slow to like evolve and adopt new things, but it seems like it would be really cutting edge and attracting great patients. I just want to play devil's advocate for a second. And if a hygienist says, okay, I know how to probe, I know how to look at inflammation, and I'm just going to do SRP, why would they want to use a microscope if they say that they're already doing those things?
When you're doing probe depths, you're measuring what has already happened. So, infection or disease process that's already happened, bleeding, it's already happened, x rays,
Mhm.
bone loss, cavities, these things have already happened. With the microscope, again, we're talking about biofilm. So, we're really trying to get to that root cause and prevent. So, hygiene is prevention of disease. And this
Yeah.
is a tool that is is very helpful. I don't want to say the essence, but it's extremely helpful in prevention. So if you're
And
a
just that education piece too, like, people who have used the intraoral camera, I love your analogy with that, they cannot practice without it now, and so I would imagine you probably feel the same way about the microscope, right?
100%, you can also use, I mean, more than if you have more than one hygienist, you don't necessarily have to have two microscopes. One, you can put it on a
Okay.
cart and move it around. Now, in a perfect world, what I would want is everything in one room, right? The
Yeah.
patient comes in, they're seated, you show them the biofilm, which they don't have to get up, they don't have to leave. Which brings me to I did kinda wanna talk about the setup of it. I don't know if I did that
Yes,
yet. Did
okay, I wanted to ask you about that, and I also wanna ask, like, because 'cause I'm into ergonomics, right? So I'm concerned as far as, like, where it is and how it's being used. Yes, so please tell us about that.
Okay, so when I say the microscope, it's really three things. It is indeed a microscope, but a camera to capture images, live videos, things like that, and a screen to shoot it onto. So we are not looking through this. That's what that camera does. And then you shoot the image. You can shoot the image to a giant screen on the wall. You can
Hmm.
shoot the image to a big monitor on a table, a computer, a tablet, anything for patients to view it. But in a perfect world, I want them to come in, sit down, and never have to move. You get the biofilm, you stand up, walk it, put that slide underneath the microscope, and then you start giving the patient, the tour of their biofilm. But they're seated and just watching you do this. And you're, looking at the same screen that they are pointing things out. So you're not doing this either. You're looking at the screen. I like that. Well, like you said, for ergonomics, it's great, right? We're all just kind of like
Yeah.
this. But it's also to move that patient for the speed and ease, right? Again, time is of the essence. We don't need to dilly dally. And it's not always easy, we know, to get the patient in a chair. So if you're asking them to get out, it may sound really simple, but we know that that's not
It can be
always
a
the
whole thing. Yeah.
right. You are right. A whole thing. So it just takes up too much time. It's like, no, just get the big screen, show them it's really cool. It's more fun. We all see it. Again, for time, I like it. Really, everything being right there.
Does it integrate with like practice software or is it just completely separate? Can you put the images into the patient's chart so you can kind of track over time?
So different cameras do different things also. I know there's some that do Wi-Fi, so airdropping images. The problem though, if you try to keep that in your system, it's too much. It's just too much info. Do you know what I mean? Like
Like the
too much
files
data.
are too big type thing? Okay.
Yeah, we're trying to keep everybody's. So you can put it in a separate place, or I think the easiest is just one, you can describe it in your notes a lot too, like high risk due to blah, 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 blah.
Mhm.
Medium risk, low risk. You can put it in your notes. Patients really do like it though too. So you can, if you have airdrop, poof, here you go. And Pam, you keep it, mark it March 2025. And when I see you 3 months down the road, you'll pull it up. We'll both look at it and we'll compare it today. I'll drop you another one or whatever. So you can
Oh,
you
that's
can
so
do that
nice.
too. Um, so yeah, that's one of the things patients love it. And then when they have it, this is the other deal I tell offices. Some patients, social media is a thing right now, and they put that out, "Hey, this happened at the dentist today. This is what I had." Like, yes, like, let everybody know, and if you have social in your office, I'm like, put it on your social media. Let people know
Yeah.
what you're doing.
Yeah, because it's so unique and it does seem cutting edge. So, as far as training, how does that work?
You would get a microscope and get trained on it,
Mhm.
basically.
Pretty
There
simple.
are weekend courses that you can do, so it's not that long. I guess maybe you were asking that question. I was like, it's just not that long. It could be a weekend course. When I was trained on it years ago, that's what it was. It was a weekend course. We had somebody come into our office and train us. So we got the microscope first, had it kind of all, here it is, it's up and ready. Come in and show us how it will integrate in our office. And that was really helpful. I loved that. Now I know there are courses that you can go to and they train you on it. And again, it's kind of a couple of days. That's
Okay.
another great option. And then me, when I was using it and going, how in the world can everybody do this? And it was right. I had been thinking about it for some years. And then 2020 happened. And we didn't get to travel as much and we didn't get to go to all the conferences that we wanted to. And then I had a lot of people tell me they didn't want to anymore. And cost, when you're talking about sending your office by the time they get on the plane, by the time they get to the hotel, food, all of the things, that can be really pricey. So for those two
Yeah.
reasons, travel and price, that's why I was like, you know what? There's no reason why we cannot do this online. So that's why I was like, okay, I want to do an online course. So that's what I did, which is still, we would Zoom, communicate, whatever. If offices, believe it or not, I have offices that have microscopes that haven't been using them. And so they reach out to me, hey, I've got this thing. How am I going to use it? That's an easy lift right there. So I can just talk to them and I'm available
Yeah.
to talk. And because I just told you I love to chat and hear other people's stories. So I'm always available for that. But the online course will do everything and it should answer any questions, but I'm always around if they have more questions. If they do not have a microscope, I help source one for them as far as what are their needs in their offices, like what is their space. If you have a big space, that's great. If you have a very tiny space, we don't need something big and bulky, right? Like, again, space is of the essence in those places. So I help them find a microscope too. And then we go on about the training.
So you created a company, right? It's called Dental Reveal, right?
It is,
And
yes.
is this the training, like you are doing this training for offices and like helping them just onboard and like create this microscope program in their office?
Yes. Initially, when I did it, I was thinking it's just because when we hired another hygienist on, who everybody helps train the hygienist, but at the end of the day, when it comes to that microscope, it really does tend to be the current hygienist that needs to help the new hygienist. And
Mhm.
that does take time and not a lot, but when you're also in the office, you need to be producing.
Yeah.
So again, you're like, I don't want to take away from that production time. So then I was like, you know what? We should just put this into the onboarding process. And if this person can either come into the office and watch it in one of our spaces in the back or whatever and get kind of trained up, or hey, can they watch it in their pajamas at home and like really get into it and get the gist of it? And then they'll get the hands on part when they get in the office. That's helpful. And it's really important that everybody in the office know they don't have to know how to read a biofilm sample, but they need to know a little bit about what you're doing and why. I mean, the front, when I like for when you're going to start, whoever's going to do the recalls and remind patients, hey, tomorrow we're going to see you at 9, right? You're going to be here. Just do what you would normally do. That's another important thing. So don't show up to the office and brush your teeth and get everything off. Do not dispose of the evidence. That's not what I want you to do. I want you to come in and I want to see
Come in
like what
dirty.
right? Like what is
Yeah.
there? Like what is your normal? I need to know what your normal is. So whoever is doing that, reminding the patients can say that, don't forget, we're going to take a biofilm sample today. We want to see what's going on in there. So don't do anything crazy before you come in or just do your normal crazy, whatever that is.
Yeah, yeah.
And then that way, when people call, they are whoever's answering your phone and helping patients in that process. Yeah, here's what we're doing. Here's why we do it. So it is important, I think, that everybody at least knows a little bit about it. And that course is great for that too, just onboarding for everybody.
That's awesome. Yeah, because I would imagine, like, some dentists or practice owners, when they're have a new hire or something, it's like they're gonna have to train them, so that makes sense. But it's the same thing if an office is utilizing laser and then they have a hygienist who isn't trained in laser, they're gonna send them or get them the training or whatever. So they're gonna have to do this with microscopes too. But I like what you said about the whole team being on the same page. God, that is like a super underrated factor with case acceptance. But if people aren't speaking the same language, it's so confusing for the patient and they're not getting that like reinforcement. What do we need to hear the same thing like 7 times or whatever to remember it or something?
Yeah,
So if the team isn't talking the same language, it's really not going to help with patient education or case acceptance.
that's a good point. Like, I feel like I take that for granted. One of the docs I worked for, she would come tell patients, like, that was part of our routine when she would come in to do the hygiene checks was what's the biofilm look like? Just like what are the x-rays? What's the biofilm look like? And then if this patient is wanting to do, that was another, she did it beautifully. This was another way. It was like, "Hey, we have to get this biofilm healthy because I'm not gonna do X, Y, and Z. I'm not gonna put an implant in a perio biofilm. I'm not gonna do these surgeries, and I'm not gonna do all this beautiful restorative work on you. Like, you need to
Yeah.
get your house in order kinda deal." In the nicest way possible. She said it very nicely, but you know
Yeah.
what I mean?
Yeah.
Like, so they were motivated, "Okay, yeah, like, this is the foundation. It was a great way to go. We have to have a good foundation, and then we'll do all these other things." And so, yeah, you're right. If she had not been on board or if she was like, "It's fine," no, it was you're right, everybody working together. I feel like I forget about how important that is. Well said, you.
It is. I mean, I've seen it both ways. Like I've seen practices that it's like a machine, like everyone's on the same page and I see the difference versus a practice where it's like the hygienist is trying really hard to diagnose and treat perio and then the doc comes in and says everything looks fine. It's like that it's a disaster when that happens. So if people want to learn more about you or your company or want to get in touch with you, what's the best place for that?
I have a website, dentalreveal.com. So
Okay.
there's, a lot of information on the website. As far as social, I feel like the social platform I hang out on the most is Instagram because I don't know, it's
Okay.
just fun,
Me too.
quick and easy. I
Yeah.
feel like I really need to like get into LinkedIn and like do some of that. On Instagram, I'm Kristen King Dental Hygiene. Facebook, again, I need to do more on that one. That one's going to be dental reveal and then dental reveal on LinkedIn, which I got to, I don't know, dust the cobwebs off of that one and maybe get more involved.
Well, I'll definitely link your website and your Instagram for sure down in the show notes so people can connect with you. But any closing remarks or final thoughts about microscopes?
I would just tell people don't be intimidated. Everybody thinks, oh my word, it's expensive and they're hard to learn. That could not be further from the truth. Again, I don't know a single person that says, man, I wish I didn't have one of those. Everybody
Yeah,
can't
and
yeah.
it's like we're so I mean, we in dentistry, we're smart, like, we can figure this out, and as far
Right.
as the cost, it's an investment, and if it can increase case acceptance and ultimately get our patients healthier, then it's 1,000% worth it.
Yeah, it is.
Awesome. Well, thank you so much, Kristen, and I hope this was a good start to your day. It's funny, it's like my day's just ending and yours is just starting, but thank you very much for carving out some time for us today.
Thank you for having me. It was so fun.